Will? Professor Mark, sit you. Let's go ahead and get started. Good evening, and thank you for joining us this evening for the Nursing White Coat Ceremony for Rocky Mountain University of Health Professions. My name is Dr. Janet Knowles, and I am privileged to be the chairperson for the Department of Nursing. And I would like to introduce my marvelous faculty, because I know as family members with students doing clinical rotations and being in class, you'll probably hear lots of positive things about these faculty members, and I want you to be able to recognize their faces. So the director of our Family Nurse Practitioner program is Dr. Megan O'Neill. Stand up. Okay, there you go. Other faculty members, Dr. Elsha Drummond, Dr. Courtney Gormas, Dr. Kristen Shue, Dr. Corey Sieslove, Dr. Emily Levan, Dr. Kevin Ballard. And there are several other faculty members that are not with us on site as they don't teach clinical classes, but there are other names that you might hear as well. We are supported in our faculty roles by three very talented administrative persons: our clinical coordinator, Amy Siemens, our coordinator of operations, Melissa Capps, and my administrative assistant, Erica Hannafin. At this time, I'd like to present the president of the university, Dr. Cameron Martin.
Thank you, Dr. Knowles. It's great to be with you again, right? Some of you we saw earlier today. Thank you. This is a great moment. This is a moment, an inflection moment, something to celebrate as a rite of passage, if you will, as you now go on in your clinical experiences. Now, you're all seasoned professionals. You've been out there doing that. You've been on the front line, saving lives and helping people in their time of need. It's a little different than some of our students that come through the white coat ceremony. But we do this white coat ceremony because it is a moment, a time to reflect upon and appreciate, and it's an experience in preparation as you go forward in your clinical experience. So I'm honored to be with you here tonight. And if I can, you know, how many times have you been to an event like this and somebody talks and you remember anything that they say? I mean, really, be honest. No. Thank you for your honesty. Big, bold, no. So sit down now. Thank you. No. My goal today is to hopefully break that, to give you 5 points, 5 things that you can remember. And the reason you can remember that, because these 5 points emulate your experience here at Rocky Mountain University and out as you go on and become practicing nurse practitioners. And it also shows that your connection to this institution through our brand. You look at your white coat. It has the logo of Rocky Mountain University on it. Next to it is a shield. That shield has a hand, right? That hand makes the valley, which we're here, our location, right? Utah Valley, and the mountains here at the Rocky Mountains. And there are 5 things that I'd like to associate to those 5 fingers in hopes that you remember this as you go on to this next step in your journey of becoming a licensed nurse practitioner. The first one is to remember your why. Why did you do this? Why did you get into the nursing profession to begin with? Why go on and become a nurse practitioner? I guarantee most of you will say, well, because you care about the one, the individual, and the experience, and you want to do more because you know it's in you. I think that's great. Just remember yourself and your why you're doing this. And now the second one would be, remember what it's like to be a patient. You've all been a patient, I'm sure, here and there. And the practitioner who helped you, or the clinician who helped you, that listened to you, that took time to be with you, they're the ones you remember. They're the ones that you're like, I'm going to go back. My wife and I recently had experiences this last week with a medical appointment. And the person we met with had read the file, go figure, and had referenced things in the past. So we understood she cared for us. She was knowing what's going on. So that's really important to just remember what it's like to be a patient and to treat each patient as if it's yourself or your family member. Be present in that moment. The next is to remember your training. You've had your foundational nursing experience, and now you have our amazing faculty who have helped prepare you for this next step. As familiar as you may be to the environment you're going into, the role you're now going to be expected to play is elevated. You got to trust the training that you've been given and are still receiving. Trust in that training and phone a friend. Call your faculty as you're going through this experience. Hey, I got this. What do you think? Engage in them as a colleague and peer. And the fourth thing is to say thank you. Remember to say thank you to the patients that you're with. Thank you to the people you work among and with as well. Nobody likes to be around the person that just sucks all the energy versus the person who helps build that energy within the organization. Gratitude is such a powerful, powerful influence in people's lives. And when it comes from a person such as yourself, is in a position of knowledge and know-how, that gratitude is amplified. Now, the fifth thing for you to remember is that you're adorning yourself with the brand of this institution. To remember to be an ambassador of what we stand for at this institution, which is to remember that we're all about improving the human condition. That's what we're driving towards. And we do that by loving and lifting those in need. To love someone is to see them for who they are, meet them where they are, to listen to what they say, and then to lift them through the skills you have and that we've helped you develop. You know this. You're going to become the content experts in your field, and that's wonderful. But to lift them, to help them in their time of need. Those are the 5 things I would hope you could remember, especially as you look at the logo on your soon-to-be one day, soon, diploma that will hang on the wall wherever it may be, but also as you look at the white coat. Remember, that's my hand. I've been trained to be a part of this, and I carry the torch of this institution. Nothing is better in helping us attract more individuals like yourself to help others then follow suit in improving the human condition and loving and lifting by how you conduct yourself. How you do that is the wonderful thing that people are like, where did you get your training? And you send them here. Have them help have an experience like you've had and will yet have until you complete this journey. We're in it with you. And all these folks are here to celebrate with you. And I think if you would, bear with me, let's go back to item number 3 or 4 and say thank you. Would you just take a moment and turn to your loved ones and friends and say thank you? Do it right now. Let's just thank you. Well, I think you can do it better later. How about that? That was okay. Let's be real. That was all right. Not great, but all right. Well, thank you for allowing me to have a moment. Remember, please, to be yourself, right? To be present in the moment by remember what it's like to be a patient, to be humble by saying thank you, or remember your training, saying thank you, as well as then to remember that you're a champion and an ambassador to this institution, for which we are very proud. Congratulations on this moment in time. Celebrate it. Use it to catapult you to greater things. Thank you and congratulations.
I'd now like to introduce our provost at the university, Dr. Melissa Martin.
Good evening. Now, we are the Martin Squares, but we're not related. So, I bet you'll never get to another institution where you have Martin Squares as the leaders of the institution. But if you do, give us a call because we're going to record it. But anyway, I thank our president for his words, and I really want to thank our outstanding faculty and our department chair, Dr. Janet Knowles. I had the opportunity to hire Dr. Knowles. She was with us years ago, and when we had an opening, I knew exactly who to go to. And I asked Dr. Knowles if she would come back because she's excellent in assessment and knowing how to develop outcomes in a curriculum and knowing how to care for students and to produce quality students and also how to lead her faculty. And I hope that you have experienced that so far. But as you get your white coat tonight, this is a memorable moment for you. It really is. Take a deep breath. Think about it. Think about what you've been through. You are already practicing professionals, but you chose to expand your knowledge, to enhance your skills, and to open your heart more because you will affect more and more people. We feel like we have touched 26 million patients since we opened up our institution. 26 million. But that does not count all of the students that we prepared, meaning that our faculty have prepared, that we have prepared faculty to go out because we do prepare teachers. It doesn't count all the scholars and research we've done at this institution and how we've affected the world in many other ways. But you will be affecting every patient you touch. And you will be carrying the Rocky Mountain University healthcare brand. And there's a lot to be expected. I used to work at a liberal arts school that was religious-based, and our president always said, to wear the crown, you must bear the cross. And I'm going to pass that on to you, because to wear the crown, the white coat, is to bear the cross of all the work you've done and what yet is expected of you. And again, to what is given, much is expected. So I'm going to wish you the very best as you continue in your field, and I will see you at commencement in the near future. But please, we thank you for choosing Rocky Mountain University. We thank your supporters, and the best thing you can do for us is continue to tell others about our institution. Thank you very much.
All right. For those students here this evening, it may have been a bit of time since you thought about Florence Nightingale. For those guests that are here tonight, you may not know of Florence Nightingale other than from maybe your high school history courses. But I want to give you a little bit of background about the white coat ceremony and flow. The white coat ceremony, often being compared to the Hippocratic Oath for physicians, the Nightingale Pledge serves as an ethical guide for nurses, emphasizing a commitment to patient care, integrity, and professionalism. Despite being over a century old, the pledge remains relevant, influencing how nurses approach their roles in today's complex healthcare environment. The Nightingale Pledge was first created in 1893 by Lystra Gretter and a group of nursing instructors from the Farron Training School for Nurses in Detroit, Michigan. The pledge was named to honor Florence Nightingale, whose contributions during the Crimean War set the foundation for modern nursing. She's the one that said, "Wash your hands between patients." I mean, what a novel idea, you know? Originally, the pledge was intended to provide new nurses with a formal commitment to the ethical standards upon which the profession is based. It was a concise summary of the values that Nightingale advocated: compassion, dedication, and respect for the dignity of the human being. The original Nightingale Pledge reads as follows: I solemnly pledge before myself, before God, and in the presence of this assembly, to pass my life in purity and to practice my profession faithfully. I will abstain from whatever is deleterious and mischievous, and I will not take or knowingly administer any harmful drug. I will do all in my power to maintain and elevate the standard of my profession, and will hold in confidence all personal matters committed to my keeping, and all family affairs coming to my knowledge in the practice of my daily caring. With loyalty, will I endeavor to aid the physician in his work and devote myself to the welfare of those committed to my care. This pledge reflects the values and norms of the late 19th century, emphasizing loyalty, moral purity, and dedication to patient care. It also mirrors the limitations of the era, such as the subordinate role of nurses to physicians and the gender-specific language which reflected societal norms. Over the years, the Nightingale Pledge has undergone various modifications to reflect the evolving nature of the nursing profession and societal changes. Modern versions of the pledge remove the religious and gender-specific language and focus more on universal principles of ethical practice, patient confidentiality, and professional development. There are several examples that I found, one of which is, I pledge to care for my patients with all the knowledge, skills, and compassion that I possess, to uphold the standards of my profession, and to safeguard patient confidentiality. I will maintain my professional integrity and continue to advance my understanding of nursing through education and practice. Despite the changes in wording of the Nightingale Pledge over the years, it is still profoundly relevant in modern nursing. There are 5 concepts that are identified in the pledge, and many revised pledges demonstrate how the pledge continues to be relevant today. The first, ethical foundation and patient care. The second, professional identity and pride. The third, advocacy and patient rights. The fourth, commitment to lifelong learning. And the fifth, interdisciplinary collaboration. When we consider these 5 concepts, we find the 7 core values of Rocky Mountain University reflected. The RMU core values are that we want to be evidence-based. We infuse our expertise with the best available evidence to achieve the best possible outcomes. We're learning-centered. By challenging thinking, encouraging growth, and exploring possibilities within a supportive learning environment, we empower our learners to rise to their highest potential. We're authentic. We recognize our imperfections and we welcome growth stemming from both success and failure. We believe in our unlimited capacity to find solutions. We model gratitude. We seek to understand, to empathize, and to forgive. We are service-oriented. Because we value people above all else, we serve each other, our patients, our clients, our communities, and the world. We are trustworthy. We strive for honesty, respect, accountability in all that we do. We continuously determine to earn credibility as an institution and as individuals. We are inclusive. We honor our differences and similarities. We strengthen institutional and community connections. We're collaborative. We learn and create within and across teams to innovate, foster change, implement strategy, ensure accountability, and celebrate achievement. The identified nursing concepts and the university core values are summarized in the nursing department mission and visions and value statements. The mission of the Department of Nursing is to provide a student-centered education that prepares graduates for socially responsible, outcome-oriented, evidence-based, autonomous, and collaborative practice. The vision of the department is to prepare graduate-level nurses to advance the quality, delivery, and efficacy of healthcare. As you accept these white coats today, we invite you to stand next to us as nurse practitioners, providing confident, compassionate, evidence-based care to individuals, families, communities, and populations in our ever-changing healthcare environment and world. We want you to go forward and make a difference, change a life. At this time, I'd like to invite Dr. Kevin Ballard to read the names, and the students will come forward, and Dr. O'Neill and I will help you with your coats.
Scott Bagg. Carson Bingham. Kelsey Carlisle. Michelle Chafin. Roman Gorola. Linda Hall. Sarah Hanson. Abby Harding, Kylie Hatch, Julie Hill, Molly Juback, Sarah King, Kayla Lowe, Karen Lonsdale, Justin Nielsen, Christy Red, Jack Schwartz, Danielle Smith, Cassie Vanderwerf, Jacqueline Young.
In conclusion of our ceremony, oh, sorry. See, that's what happens when the president gets hold of stuff. You know, it just kind of. Anyway, Dr. Ballard and I have had the privilege of working with Dr. Loretta Ford as fellows in the American Academy of Nurse Practitioners. And I want to say again to the students, there is a marvelous path ahead for you. And there are many, many people that want to encourage you and guide you and provide for you any type of resources and things that you may need to be your best. So congratulations again. We would invite the students and their family members to participate in some light snacks over here to the side. And we thank you again for coming and celebrating this wonderful time with the students. Good night.
Student, can you hear, is this on? Let's do a group picture. So before you mingle, come up here on stage, we'll do a group picture, okay? Do you want your water?
Now, this is because our president has been in charge of operations at a big university.
That he feels comfortable moving the stage around.
Yeah, I didn't know the mic was not on. I would have turned it on had I known it.